Welcome everybody to Go Local Live. I'm Josh Fenton, CEO and co-founder. A little quick news before we get to Dr. Moreno De Luca from Warren Alpert, the medical school at Warren Alpert. A couple quick updates. First, I want to thank our earlier guests, Courtney Nicolato from the United Way and their effort to raise $1 million today to support nonprofits. That's going well. If you get a chance, make a donation, click through to Go Local. There's lots of links over to that effort, and you can direct it to the nonprofits you're most supportive of. Secondly, I want to thank Dr. Fine, who gave some great insights into the modeling that's going on both nationally and hopefully soon being released here in Rhode Island. Third, I want to thank Ken Doctor, the leading media analyst looking at the news media and especially the newspaper industry. He Skyped in from California. Now let's jump over to Brown's, one of the top researchers on the issue of autism, Dr. Moreno De Luca. Thanks so much for joining us.
Thank you very much, Josh, for inviting me. I'm very glad to be here.
And glad you're healthy and safe. No one in Rhode Island wants anything to happen to anyone in healthcare right now. We are so completely dependent on all of you to keep us safe and well. So glad to hear you're of good health. Let's talk about your trip, how you got to Brown University. Give us a little background on that.
Okay. So briefly, in a nutshell, as you can tell from my accent, I am Colombian. And I did my medical school back in Colombia in South America. And then at that point, I really knew that I wanted to focus both on psychiatry and on genetics. And I thought I had to pick between the two. But it turns out that there's this entire new field called psychiatric genetics. And autism seemed like the best opportunity to fuse those two interests together. So after finishing medical school, I went to Italy for a little bit, and I did a short fellowship in autism genetics at the University of Bologna. And then from there, I went to Paris in France, and I did my master's in neuroscience at the Sorbonne, one of the branches of the Sorbonne. And then I knew that I wanted to do my clinical training here in the US because of the great programs that are here and the clinical networks that you can have access to. So I came to Emory University for a postdoctoral fellowship in neurogenetics. And from there, I moved on to Yale University for my residency in adult psychiatry. And finally, I came here to Brown for my fellowship in child and adolescent psychiatry, where I stayed on board as an attending psychiatrist at Bradley Hospital and an assistant professor at Brown University.
Tremendous experience, tremendous worldview. You've been doing work on sort of the genetic indicators related to autism. Talk about what you've learned and where you think the science is going in the near future.
Great. I think that's a great question. We know that autism is one of the mental health conditions that has the strongest genetic basis, and that is because we know that the chances of someone having autism are greater if there are other people with autism in the family. So we have a fancy way of talking about that in research, and that's called heritability, which, on a side note, does not mean that something is heritable, but is just a way of measuring how strongly genetic something is. So the genetic basis for autism is very high. Now, what we also know is that there's no single genetic cause for autism. And in fact, many of the studies are showing us that there's hundreds, if not thousands, of individually rare genetic variants that when we put them all together are going to explain anywhere between 30 to 40% of cases of autism. So what this means, again, in a nutshell, and just so that we get the impact of this information, is that potentially 1 out of every 3 people with autism are going to have an underlying genetic cause for their autism, even if those individual genetic causes are going to be very rare. So each person with autism might have a different rare genetic cause, but together they can explain 1 out of every 3 cases of autism. And our work focuses precisely on those rare genetic changes. We want to identify what those individually rare genetic variants are, try to understand how they lead to clinical presentations like autism, and to understand what other areas of mental health are impacted and of physical health are impacted by these rare genetic changes, as well as what strengths, not only the challenges, but also the strengths that people with these rare genetic conditions might have. So we can build on those strengths address the challenges, and ultimately bring that to the clinic to help the people who come seeking clinical help.
Is autism becoming more prevalent, or are we better at detecting and defining autism?
So I think there's a lot of things that have been changing on the autism landscape. And you're right that the actual prevalence numbers have been going up. So some of the recent estimates put it at as high as 1 in 59, depending on what sources you look at. We know that many of that is going to be coming from better screening, better access to services, also from a slight change of the diagnostic criteria from before. In psychiatry, we use something called the DSM, or the Diagnostic Statistical Manual, and we moved that to the newer version, so that might lead to some increase. And even after correcting for all of those reasons, it is still possible that we're witnessing a little bit of an increase on the actual prevalence. So there's a lot of factors that are coming into play there.
How fast is the science moving? Do you see us finding key milestones in the research in the next 2 to 3 years, or is this a much, much longer play?
Science is moving at an unprecedented speed. I'm very surprised to see more and more of the studies that are coming out to the point where science is moving so quickly. That's what needs most of the work, is our ability to analyze the data that we're acquiring and our ability to make sense of all that vast amount of data that we're getting. So, for example, in the genetics side of things, the resolution of the genetic tests that are considered the standard of care for people with autism have been increasing more and more, and the cost has been decreasing more and more, to the point where many of these tests are now covered by insurance and are easily and readily available for families who want to do that, and to the point where we are moving on to techniques called whole exome sequencing and whole genome sequencing that look at every single letter of our DNA code. So there's no higher resolution than that. So now the focus is on what do we do with that information. So there's a lot of groups that are trying to understand how those individual genetic changes are going to translate, let's say, into specific biological and molecular functions. And then there are a lot of groups like ours, where we're trying to understand what are the implications for people, for actual either patients or participants in research studies, or people walking out there in the community. What are the implications of those genetic changes in regards to their mental health and to their physical health as well? So I think things are moving extremely rapidly, and I'm very excited about what's coming in the next couple of years.
Will we lose momentum because of the coronavirus impact as almost a global standstill? Or will the research continue to progress in a new decentralized way as people work from home and work off campuses and work outside of labs?
So I don't want to minimize that this is having a strong impact in research. Many labs, especially the labs that are dependent on actually going to a physical place where they do their experiments with pipettes and all of these, they are having to stay away from their workspaces, and that's research that cannot happen from a distance. Now, I tend to have an optimism bias, and even if sometimes I just see the silver lining in things that are happening, without discounting that this is a very serious situation. But I think this is also helping us to move into directions at a speed that is unprecedented, and that ultimately will help some of the research that we do. For example, part of the research projects that we're now proposing to do focus on digital and remote phenotyping, which means that we are going to be able to interview families and do some of these neurobehavioral or other types of assessments from a distance, and that is just going to be much more important nowadays, which will remain hopefully after the coronavirus crisis ends. So that kind of is taking down a lot of barriers that were previously there in regards to reaching out to patients and to participants and families wherever they are, and is making all of the research community think creatively about how can we make the most with the resources that we have right now.
Dr. Moreno De Luca, This is National Autism Month, and obviously trying to bring more attention to autism. Autism for parents can sometimes be a difficult parenting challenge. Now you're taking children who are getting, in many cases, special education to be able to assist them in their development, and you're bringing them back to their homes on a 24-hour basis because schools of all types are now closed almost across the entire country and in many parts of the world. What's the implication of that on families with autistic children?
That's a very good point. And besides my research efforts, I also have a clinical practice where I see almost exclusively people with autism who need clinical care. And we have been hearing from many of the families that they're starting to face these challenges. As we know, one of the most important things for families and for kids and adults with autism is to be able to know what's coming, to have a clear idea of the routine, and to be able to do what they need to do on a daily basis. And all of a sudden, this routine has changed dramatically. So school is not happening. Many of the kids that we see in the hospital with autism actually go to school even throughout the summer vacations just to keep that routine going. And now we have to readjust to that routine. Now, there are ways that we can help that transition. And for example, there are social stories that are ways that we use to explain and to discuss with families and with kids with autism what's going on and what's happening, and so that they can know what to expect. There's also an unfortunate implication for services that families receive in their homes. So there's, for example, something called applied behavioral analysis therapy, which is one of the things that has shown the most evidence to be helpful for people in autism who need that. And clinicians who perform those types of therapies are no longer able to go into people's homes as easily. So it has been a big adjustment for many of the families we see. Empirically, many of the families have been making this transition fairly well. And again, this is just based on my own clinical observations, and I don't want to minimize, again, the severity of what we're facing. But I think, as you were saying, this is a joint effort. All of the community is pitching in. The school departments are doing a remarkable job. The mental health and the clinical care facilities are also doing a great job by offering now telehealth services. So we are adapting very quickly to try to get to that new norm so that people's lives are disrupted the least possible. Now, again, as I was saying, because I have sort of that optimism bias and without wanting to minimize anything that's going on, I think this also presents an opportunity for people to focus on some things that can be difficult to focus on with the daily grind of our work and our school.
Yeah.
And that can be, I think, a nice opportunity for many families with kids with autism who can engage in their preferred activities. So we know that one of the hallmarks of autism is kind of restricted and very deep interests on very specific things. So this could potentially be a great time to explore those interests. It could be learning about the different types of trees that are there in your community, or trains, or outer space, or many different things like that. So again, just a silver lining on things that we can do to maybe help mitigate the impact of this crisis.
Parents of autistic children are oftentimes superheroes in and of themselves. What advice do you have for them, those who might be watching or catch us later in the week on reviewing this content? What's your suggestion to them to make it our way through this collective health and economic crisis?
First, I just want to echo that I absolutely agree with you that parents are superheroes many times. Actually, most of the times there are so many demands that are placed on them that it's remarkable that they manage to pull all of this together. Some of what I would suggest would be to continue doing your absolute best, like you have been doing so far, acknowledging that there are some things that are challenging and that might be tough to implement. So just give it your best shot and do your best within the bounds of the situation that's going on. For example, don't feel terribly guilty, and if one of your kids doesn't manage to finish all of his homework right before bedtime, or if routines are a little bit changed, or if you have to eat macaroni and cheese more times than usual during the week. All of those things right now is not the time to pick those little battles, and it's okay. My recommendation would be not to feel guilty about these things. We know that it's challenging for everyone. We are all doing our best effort, so just continue doing the fantastic efforts that you're already doing.
We've been having the pleasure of interviewing a woman who lives in Bolzano, Italy, and she is there getting her PhD. She's there with her 10-year-old daughter. She said the number one challenge for her, her child is not autistic, but number one challenge for her is that her daughter wants to read Harry Potter books all the time and not do her assigned homework there in Bolzano. She threatened to call the polizia on her daughter if she didn't get back on meeting the online learning requirements of that school structure. So I think all parents, whether they have autistic children or they're anywhere in the world, are dealing with significant complexities of going from doing their own vocation to now also adding being instructors. Doctor, end this with what else do folks need to know about what the progression of the research is on autism?
So I think if there's one message from both the clinical and research standpoint that I would like to emphasize, is that genetic testing, specifically two tests called chromosomal microarray testing and Fragile X testing, is the standard of care once a diagnosis of autism is made. It is not used to diagnose autism, but it is the standard of care recommendation once the diagnosis is made, and it's endorsed by many professional societies. It is a clinical service, so you should be able to get this clinically, and it should be covered by insurance. And it's very important because it can provide us with very helpful information, not only about the causes of autism, but help connect families with other people who might have similar genetic changes, think about family planning, think about strengths and challenges that you can supplement to make sure that people reach their maximum potential. And also to emphasize that this genetic testing is the standard of care, but that this should be a conversation that you have with your clinicians and your physicians, because the families and the individuals with autism themselves and the parents are the ones who are going to decide whether this is right for your family. So we know from our own research that once offered, the vast majority of families agree to participate, but this should be a nuanced discussion with the families. And again, I think the emphasis is that we're all working in alignment to make sure that every person can achieve their maximum potential. So whatever tools we have to our availability to see that through, even clinical or research, is what we're trying to go after.
Dr. Daniel Moreno De Luca, thank you so much for taking the time. Really appreciate it during this important time in a healthcare crisis of global proportions, but also not to be forgotten that this is Autism Month. I really appreciate you taking the time. All of this will be up in a standing article tomorrow on GoLocal, as well as links and information to be able for consumers to tap into. I want to thank you so much for taking the time. Everyone else, stay tuned. There's much more going on. New information from the governor's press conference earlier today is up on GoLocal, and stay tuned throughout the evening as each day there's been progressing news throughout the evenings and into the morning. Thanks everybody for tuning in to GoLocal Live. Thank you.
Thank you very much for having me.